already beginning to explore. And I know that UNESCO and UNFPA is currently supporting, an organization to develop an online CSC website where young people can access CSC information for free. And I think that's a very commendable initiative. Okay, so we've come to the end of this session. The mojito has been on my neck and has given me time up, and I know it's giving me bombastic side eye right now. But this is the youth pre-conference, so I will beg the moderator who is looking at me with bombastic side eye that I would like to please get 2 contributions from the floor. 2 persons, the first 2 persons to get to the front. The first 2 persons to get to the front. You see, that's the problem with us. I said the first 2 persons to get to the front. Somebody is raising his hand. I'm not seeing you. The first 2 persons, young people. The first 2 persons. Okay, great. So we have 2 persons. So I'm going to give you just 1 minute. Just 1 minute. You have just 1 minute to, if it's a question, a contribution.
All right. Good day, everybody. I want to thank all the panelists having paid attention to the session. I greatly appreciate all your work in the HIV sector. So since I have 1 minute, I'll shoot straight. And my question is to Sir Opeyemi. I appreciate the work of Nibuka in advocating for the rights of persons living with HIV when it comes to employment. Now, it is evident that once someone is employed under an organization and he is relieved of his job based on his or her status, Nibuka can slide in and advocate for that person's retainment or for compensation. Now, how about a scenario where we have been shortlisted for employment or we have just applied, and then I know very well that I am highly qualified amongst all those applicants, but maybe due to the fact that we were required to have HIV tests done as one of the processes, and then I'll just say I have been denied employment opportunity in this organization. We know we are working with evidence-based, should I say, results. Now, how can Nibuka come in, or does this person have a case, knowing fully well that he really did well in the interview and he has all the requirements stated in his or her curriculum vitae? All right.
Okay, my question also goes to Mr. Opeyemi. I know, Mr. Opeyemi, your organization, Ibuka, has really done a great work. I know when I started with you, and I know where we are right now. But one thing I would like to talk about is when you say if they deny you of job opportunity, you are there, they can run down to you. For me, I am not saying it from that aspect, but where I'm seeing it from is the meaningful involvement of people living with HIV. I think the organization have to go back to that, to that intervention in making sure that you plot people who are living with HIV, most especially face of HIV, to a workplace. There was a time we did that. And it works for a short period of a time. But we're looking forward to see when this thing will be implemented and it will be well known, because I know Mobile, all these oil companies, Dangotes, blah, 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 they supported Naibuka. I want to see where one day we will be able to see a phase of HIV at Dangote, and we will say that, oh, that person, I know him or her. They are our people. Are you getting it now? So that is what I want you to work on. You can speak with Mr. Jekuz Ozomene to do more better for us. Thank you so much.
Thank you, Please, can we appreciate them? Okay, so I think Naibuka has all the questions. So yes, we'll just. So you have 1 minute to answer these questions.
Permit me to stand up.
Yes, please, you are
All
allowed.
right. Thank you very much, Maxine, the newest lawyer in town. Um, Basically, if you listen to me at the point when I was making my contribution. I said at the point of employment. I don't know whether you can recall. So, however, you also made mention about even after you have gained that the employment and you are now relieved, we take care of before and after. And not only Nibuka, just as I said, it's collaboration. You can report to any of the development partners, NACA, and even SACA and others. But we take that seriously because we have the document to back us up. When you go to Anti-Discrimination Act of 2014, everything is well spread out. And I want to recommend, before you leave this hall today, go online and download that Anti-Discrimination Act 2014, gazetted by the Federal Republic of Nigeria. It's the document. Nobody, no employer, no organization has a right to deny you of your rights. It's clearly stated there. Then I want to quickly go to a sister from Lagos. We will do that. We will ensure that we have more of person living with HIV as the face. But remember, the issue of having the face of person living with HIV, either in Dangote or MTN or Hete, is a matter of choice. That individual should accept that I want myself to be used as a face. We have so many employees that are living with HIV, but you will not know because of what? Privacy and confidentiality. That's the word. That's the word. And that's why you will not know. So I'm standing here, you may not know. As we have all our distinguished participants here, we will not know because of confidentiality. But I want to assure you that the recommendation you have given to us, I will take it back to my MD, my CEO. It's going to be around tomorrow as well. He's on his way right now. He should be in Abuja right now, in person of Dr. Jeku, the double CEO of HIV Trust Fund of Nigeria and Naibuka. Thank you very much.
Thank you very Thank you very much. Though we cannot take any other question, contribution, our panelists are on ground. So if you have any question, you can meet up with them after the session, and I'm very sure that they would give you their audience and answer whatever question you. So we've come to the end of this distinguished panel session. I would just like for all our panelists in one word, one word, tell us something that the young people should take home today.
Be committed to what you believe. Commitment to what you believe in.
Commitments.
Stand by your rights.
Stand by your rights.
Let's act more responsible as young people.
Let's act more responsibly as young people.
We can do it.
We can do it.
Be a change agent.
Be a change agent. Please, can we appreciate them as they step down from the stage? Thank you so much. And me, I have my own one word. I have my own one word, and my own one word is this. Please, as we go back, APIN, all the youth networks that are here, kindly make sure that persons living with HIV know about the Anti-Discrimination Act. If that's the only thing you can take home from this conference today, please do. Let them know about the Anti-Discrimination Act and the places that they can report when injustice is being done to them. It's extremely important. Thank you all so much for your attention, and I wish you all a restful and amazing rest of your day. Thank you.
Please, let's give them a round of applause. This is a resounding one. Thank you so much. So very quickly, we'll be moving to the next session on the agenda. Before then, please, can we give ourselves, how many of us know the Atama clap? How many of us know the Atama clap? So we'll be doing that for ourselves. 1, 2, 3, go. Atama! Atama! Labako! Labako! Labarina! Atama! Thank you so much. So very quickly, we'll be introducing the moderator for the next panel section, which is the Gen N session. The topic is integrating sustainable HIV prevention strategies for adolescents and young people. Please welcome on stage the moderator, Adobe Olisa, FHIP. By a round of applause.
To do with this thing. I want to give this.
Thank you, everyone, for being here today. My name is Adobe Olisa, and in just a few moments, I'll be giving you a brief intro to our panelists and the session today. But we're here to talk about Gen N, which was designed by the young people for the young people. Young people, make some noise for yourselves. Thank you. Next slide, please. Next slide. Okay. So here is how the session will go. We will start with a very brief introduction. No, no. You're going to go back, please. Okay, I'll just keep going while they're trying to sort out the technical glitch. So we'll start with an introduction where we'll introduce the panelists and the great speakers we have today. And then I'll just tell a brief story of Gen N. How many of us have heard about Gen N before today? Show of hands. Oh my, oh my. Just like 5 people, okay. Thank God we're all here today. So we're going to learn about Gen N, hear the story behind Gen N and what Gen N is all about. And then we will have a panel discussion with our panelists, a Q&A session, and then we'll wrap up. Next slide, please. So this is just a summary of my CV. I am Adobe Olisa. I work with FHI 360 as a technical officer on the Mosaic project. The Mosaic project is currently supporting the scale up and introduction of new HIV prevention options, including injectable cabotegravir. Who has heard of CAB PrEP before? CAB PrEP. Okay, we have a session tomorrow that will talk about CAB PrEP. We're expanding the landscape for HIV prevention. So we don't just have oral PrEP, daily oral PrEP. We now have an injection and we're bringing that into the country. So tomorrow you can join our session by 11 to learn about CAB PrEP. But I represent Nigeria on the Next Gen Squad, which is a group of vibrant young people from across 9 countries who support and ensure meaningful youth engagement across Mosaic activities. I also supported, I'm so proud to say I supported the launch of Gen N, the Gen N campaign in 2022 during the World AIDS Day event. Next slide, please. Will you not clap for me? Okay, introduce our next panelist. We have the wonderful Miriam. She was just here. As she's coming up, I'll just be reading her bio. Miriam, are you in the room? I can't see her. Oh, yes. So Miriam works with the National Agency for the Control of AIDS as a program officer. She has 4 years experience in public health. She's very, very interested in the health and development of young people, and she serves as the focal desk officer for adolescents and young people program, and she also supports key population intervention on HIV and AIDS response in Nigeria. Make some noise for Miriam. The next on our list, we have Chidera Gokri. Chidera is a youth advocate with the PACT. He's dedicated to scientific research and he's a biochemist who works to overcome barriers to HIV and sexual health services created by harsh laws. which we'll discuss today. He represents key populations and he's also a lean champion with NAVNAS. Make some noise for Chidera. And then we have Blessing Okaima Igaga from the Youth Network on HIV and AIDS in Nigeria, NINETA. Blessing serves as the National Secretary. She's an activist and youth advocate in the field of HIV and AIDS, sexual reproductive health and rights, and gender equality and human rights. Blessing is very um, Blessing is currently supporting HIV multisectoral response and youth-focused HIV/AIDS responses, trying to ensure effective youth representation in decision-making on HIV and AIDS. Let's welcome Blessing to the stage. Clap more, please. Let's appreciate Blessing. And then lastly, we have Philip Idoko from Education as a Vaccine Ever. Philip is a program officer. He's a public health enthusiast with over 4 years of experience in sexual and reproductive health and rights advocacy. Philip is the country focal person for the youth constituency of partnerships for maternal, newborn, child health, and adolescent health, hosted by WHO. And he also serves as the health lead for Meaningful Adolescent and Youth Engagement Coalition Group in Nigeria. Make some noise for Philip. Next slide.
Fire, baby. Fire, fire, baby. Fire.
Next slide. Yes, so on to the reason why we're here today. Just as a brief refresher on Gen N, next slide. So NACA looked at the response for adolescents and young people in Nigeria and noted some gaps which needed to be addressed in order to achieve HIV epidemic response, especially among adolescents and young people. And most of these gaps have been documented in a brief that was written by Dr. Funke Oki and was released in 2019. So they noted that various HIV interventions for adolescents and young people were actually present, but they were all focused on vertical transmission. And these HIV interventions were limited in scope. They didn't have any unifying linkage to primary prevention. And if you know about NACA's response, NACA's new strategy, you know that they are really intensifying efforts around primary prevention. And because of these gaps, it's always led to poor performance in behavioral indicators that serve as markers for primary prevention. We have fragmented social and behavioral communication initiatives. There are so many different brands and campaigns that are competing for the attention of the same young people. And then these activities are modestly funded and they are really under pressure to achieve big targets because we know that the youth population in Nigeria is a very huge population with over 60% of our country's population made up of adolescents and young people. Next slide. And so Gen N was launched in 2022. The full meaning of Gen N is the generation of HIV negative adolescents and young people. It was launched as an umbrella brand for our national AYP program. It was designed by young people for young people. Has anybody heard of the Heart to Heart campaign here? Heart to Heart, right? So Gen N so Gen N should be like heart to heart for young people. We want young people to see the Gen N brand anywhere and be able to relate and work confidently and access services, knowing that Gen N was created by them for them. It was created to intensify efforts towards the reduction of incidence of HIV among AYP. It is evidence informed, and I'm going to take you through the evidence that was gathered through the process of the creation of Gen N. Next slide. And so Gen N is not just young people. Everybody in this room is a Gen N hero. And you can strive to be better Gen N heroes. While we were engaging with young people in the development of Gen N, we heard from the young people that there are other groups of people that influence the decisions, and ultimately the health outcomes of young people. And so we had to get them involved in the process to ensure a successful outcome. And these are leaders. Leaders can be Gen N heroes by endorsing Gen N and promoting the Gen N brand. Parents can be Gen N heroes by helping their young people stay HIV negative, supporting them to access services. Providers can be Gen N heroes by providing, youth-friendly services to young people. And young people themselves are Gen N heroes and can continue to be Gen N heroes by supporting each other and committing to a future, to a HIV negative future. Next slide, please. No, next slide, please. I'll just skip this. So Gen N was developed using a human-centered design process. We wanted to build on what was already existing. We did not want to recreate the wheel. We used materials and campaigns that were already existing, and we made the process faster. There were 3 phases to the process, but I won't really go into that. But what I want to highlight is that we had over 130 young people spread across Nigeria who were providing ongoing feedback into the Gen N design, the Gen N logo, the colors, yellow and green, the name Gen N, Generation of HIV. It was all chosen and designed by young people for the young people. And it's interesting to note that even the young people living with HIV were part of this process. They were not left out because we need them. They are stakeholders. They are important in this fight to achieving HIV epidemic control. So it's not just for HIV negative, it's also for the people living with HIV. I know we have all heard of treatment as prevention as well. Next slide, please. So this just shows pictures of the sessions where we were developing the Gen N idea across the various states, different states in the country. Next slide. So lastly, I'll just summarize. What is Gen N? Gen N builds on the power of synergy. We're building on the collective power of all the interventions for young people in Nigeria. We want them to be one to ensure that the reach is wider, the coverage is broader. It unifies different calls to action under the single national banner. We're bringing all youth-focused communication under one umbrella, and the panelists will discuss that shortly. And all campaigns, we hope that all campaigns will benefit from synergies that will be created through the Gen N campaign. And thank you so much. We will go to the panel session now. Next slide. So thank you so much, Miriam. I'm going to start with you. So my question is, since the launch of the Gen N campaign, can you just briefly explain to us what mechanisms NACA is using to coordinate Gen N at the national level, and how is NACA using Gen N to ensure the integration of all the existing and new HIV prevention strategies for AYP in Nigeria?
Thank you so much. So Gen N, which is Generation Negative, is being implemented under the leadership of NACA through the National Prevention Technical Working Group Committee. The National Prevention Technical Working Group is the Nigeria's prevention platform that serves as an advisory body to the government on issues relating to HIV, and it's established to provide joint coordination, joint planning, and also drive the national change regarding HIV and AIDS, and also is the primary body for designing, implementing, and evaluating HIV response, and also provide strategic directions. Just like you mentioned about our new strategic direction, we also part of it is involve adolescent and young people in all sectors, multi-sector response, because we need to catch adolescent young. We don't need for them to be infected first before we start providing services to them. And by doing so is to promote behavior change, is to promote the first primary prevention, which is abstinence. Yes. So before we can go further into any structural, biomedical, or behavioral, or no, structural biomedical intervention, and this coordination we are doing, it has to be in line with the global HIV prevention pillars. Under the coordination of the technical working group, we have subcommittees which report to the body. And these subcommittees are based on the pillars. We have the condom programming, key population programming, PrEP and biomedical, and the adolescent and young people committee. So this subcommittee for AYP gather timely, routinely, or quarterly to discuss about issue regarding the adolescent development relating to HIV and other factors. If there is any challenges, issue, achievement, or by empowering them with right knowledge, skills to make decision about their sexual health, and targeted by also tag to see we integrate to see we reach adolescents and also cater for their needs using targeted interventions. And because this AYP have unique challenges they face in their communities, so we try to see all the strategy we develop or we come with are actually fitting into existing healthcare system and the community structures. Before Gen N, we have other initiative that we have carried, yes, such as the ISAB HIV campaign. We have the ADO kit, which is designed to support the country to reach adolescents with HIV prevention uh, program to build their capacity before and after crisis using 10 building competency domains. We also have Youthful, Alive, and Healthy Nigeria campaign, which we regard is at Ya Niger. It's just its aim is to increase uptake of high prevention tools such as the H2 via blended methods of offline by outreaches and and also online using social media too. We also build capacity of the adolescents and young people to reach out to their peers for promoting behavior change and also and measure impact and also make decisions for subsequent initiative. Thank you.
Thank you so much for that really highlighting um, response. So I'm going to move on to Blessing. That's the next Blessing. Has said the efforts of NACA to access HIV prevention since it's a national.
Okay, the challenges young people because of time. One of the challenges they face is the issue of discrimination, and young people don't like to go to. They don't. Young people would not want to come out when they know that at the end of the day they'll be discriminated. So this kind of make them not to want to access these services or have anything to do with anything related to HIV. And another challenge they face is the issue of negative attitude of healthcare workers. A situation where a young person want to access some certain services, or let's start with condom, for example. If a young person wants to go and get condom now, you can imagine what you will be hearing. Even a healthcare provider, you imagine what he or she will be saying. You are too small, you are too this, a lot of things, and that is not good for young people. Another challenge is poor representation at policy level. Uh, the needs of young people needs to be represented. And when it comes to HIV services, the voice of young people or the needs of young people needs to be properly represented at policy level so that it can address, many of the things could actually, prevent young people from accessing these services. For how Nineta wants to leverage on Gen N, first of all, I will talk about um, advocacy and awareness creation, because part of the challenge to assessing or prevention services for young people is also low level of knowledge, in-depth or adequate knowledge of what you not, access these services or want to have anything to do with. So I think one of the focus of Gen N, or one of the main purpose of Gen N, is to also be able to reach young people, more young people. So Naneta will leverage on that and see how we can, partner with Gen N, and so that more young persons can be reached. Also, we are glad to hear that Gen N has an affiliation or a connection with NACA. So we with that we are sure that the government is involved here. So Nineta will also, carry out more advocacy to the government, and also and also see how we can, speak to the government and win their hearts to leverage or to interact more with youth focused organizations. Remember, Nineta, it's an umbrella body of different youth led organizations in Nigeria. So Nineta is also going to, l- intensify or increase our voices and, speak to the government to engage more with youth organizations, dispense resources to them so that they can see how these young persons can reach more young persons. It's easier when the younger ones are reaching the younger ones than when adults are doing that. So that's
Thank you. Thank you so much for the beautiful response. I'll move on to Philip. After hearing the challenges that young people face, still worker, and the myriad of challenges face, can you just describe a few strategies that, in your experience, have been effective in reaching young people, and ideas on how the Gen N platform can leverage or intensify?
Good evening to everybody. My name is Idoko Philip. Sorry, my name is Idoko Philip, and I work for education that young people have mostly structural barriers. Just that N would have to leverage um, that messaging is not. Um, Furthermore, you can also look at from the policy here, because last time I checked, the adolescent health development policy is saying that young people, below 18, can access services at the discretion of the healthcare provider. Yes. So how can those services